Hey everybody, I'm Shane Billis, Doc Hockey for Pro Action Health and Performance. Today we're going to be discussing acute concussions, and let's just share my screen now. All right. So I want to thank Natasha Wilch and the Concussion Nerds for a lot of the information and the research that's gone behind the slides at this presentation I'll be giving. So thank you very much to them. So what we'll be addressing today is concussion definition, symptoms, physiology, red flags, myths, education, and a summary at the end. So concussion defined. So the definition of concussion, this is taken from Amsterdam Concussion Consensus in 2023. It's a sports-related concussion summit. So that's where things are geared towards, but it really works across all concussions. So the specifics are really good. So sports-related concussion is a traumatic brain injury caused by a direct blow to the head, neck, or body, resulting in an impulsive force being transmitted to the brain that occurs in sports, exercise-related activities. This initiates a neurotransmitter and metabolic cascade with possible axonal injury, which is the nerves, and blood flow change and inflammation affecting the brain. Symptoms and signs may present immediately or evolve over minutes or hours and commonly resolve within days, but may be prolonged. No abnormality is seen on standard structural neuroimaging studies like ultrasounds, CT scans, MRIs, those types of things. You need to go a little bit more specific into fMRIs and PET scans to see functional or energy that is being transmitted through the brain with messaging. Sports-related concussion results in a range of clinical symptoms and signs that may or may not involve loss of consciousness. Just that's how we evaluate things, make sure we're doing signs and symptoms and not just because someone's lost consciousness. The clinical symptoms and signs of concussion cannot be explained solely by drugs, alcohol, medication use, or other injuries that might mimic some type of symptoms of a concussion as well. So we make sure that we're evaluating properly that the concussion did occur. The domains of symptoms and presentation. So physical, cognitive, and emotional and sleep are all the main domains about symptom presentation. So with physical, most things that we feel physically, headaches, lightheadedness, dizziness, light sensitivity, sound sensitivity, blurry vision, balance issues, weird sensations. Everyone has a hard time describing pain, so weird sensations, flushing, those types of things are not uncommon to hear. Neck pain, zinging, tingling, fatigue, nausea, tinnitus, or tinnitus are all relative. The neck pain is very important because sometimes we can get whiplash, which actually whiplash comes before the amount of force that you need for concussion. So whiplash can really mimic a lot of other things, even from a dizziness, cognitive difficulties with any neck pain. Cognitively, we're looking at memory issues, word finding issues. Oh, I just can't find that word or say what I want to say. Feel slowed down, don't feel right, confusion, disorientation, foggy, zoning out, difficulty concentrating are all things that you might think of as a cognitive problem that people have. The foggy is very much a concussion kind of thing. Most people describe it as a fogginess that they get. It's not so much with other types of injuries that you get that kind of description of sensation or symptoms. Emotionally, irritability, sadness, depression, emotionally lability, anxiety, personality changes are all something that accompany possible concussion symptoms. The irritability, something we hear all this time. Oh, I usually have patience, but now people are getting on my nerves a little bit more. I've been here so long that even questions that people are asking me might have a problem. I had people that are horse trainers. They come in, they're like, yeah, now at the end of the day, like people are asking questions and I just want to go home. So a lot of times I tell them this is the time to, exit out there, just be polite and doing that. But it can really come on strongly, even in family situations where they expect you to do a lot and you don't have that capacity to do what they're asking you to do. So you get irritable very easily. Sleep is huge, not even in just regular life, but especially with concussions, because people have a difficulty falling asleep. They have a difficulty staying asleep. and they have sleeping more than normal, and they're falling asleep in inappropriate times. The inappropriate times, we don't want to change our circadian rhythms by sleeping all day and then up all night. That's really not great for helping cleaning up the brain. And we don't want to take a lot of naps either, because naps will disrupt our circadian rhythms, and we're actually not getting the deep sleep where our brain is actually being cleaned up with all those inflammation and some of the extra proteins that might be drifting around in there. So got to be careful about taking too many naps and not getting the proper sleep that we need, because it is so important. So physiologically, susceptibility. So what's really happening physiologically, right? So over here, we might have our hits to the head, might be hit to the body, necks going back and forth, anything that can cause some type of brain, as we can see here, jarring, right? So the brain is inside this, bowl of water, and it's getting hit and it moves back and forth, and it's very spike and sharp is the inside of our skull, and it can cause damage when we're doing some type of force that goes into the brain. Now, it might stretch some of these nerves. So when the head gets hit and we rotate the head, those shearing forces that rotate the head often create worse symptoms than getting a front and back hit. The ionic shift is where calcium is in and potassium goes out. And this is, the wrong combination of things for a normal cell that is trying to transmit signals and messaging, which creates an energy crisis. We need more energy to heal our brain, but at the same time, our brain is being inflamed. So the body says, let's cut down on that blood flow into the brain. And it gives us less oxygen, less blood flow, which decreases the energy that is available. Red flags. We want to watch out for red flags, okay? Trouble speaking, slurred speech, memory issues, unequal pupils, usually hours afterwards that we're looking at these because they usually don't happen immediately. Clear fluid coming from the ears, that's your CSF fluid or cerebral spinal fluid that obviously we don't want it to be leaking from our ears. Worsening of headaches. Headaches can have a reasonable thing about pressure with the brain kind of inflamed, and it's putting more pressure on our brain, causing a headache. And if it keeps getting worse, we want to make sure that gets checked out. Neurological deterioration, so weakness or numbness in the arms or in the legs. Obviously, that keeps on getting worse. It can affect balance, strength, and coordination. Loss of consciousness. So we talk about loss of consciousness, even if it's brief, we want to make sure that gets checked out to make sure there's nothing else going on, compressing of anything from, a brainstem issue or brain issue. Seizures, convulsions, we don't like to see those at any time. They're kind of scary, so make sure that gets checked out. Prolonged confusion or amnesia. People still don't know where they are. They can't remember what the event they were at, who scored the goals. There's lots of that stuff in the SCAT 5 that people can look at to make sure they're asking the appropriate questions, make sure that everything's going well. Vomiting or nausea that won't stop. We don't mind one or two of vomiting. We don't want to see it prolonged, okay? That usually means the body is trying to help out decrease pressure, and it's accommodating by that. So we make sure that gets checked out. Concussion myths. So there's lots of myths out there. I wanted to tackle these ones here so that people are better informed and they just don't take what they think they know, because there are a lot of things that have changed over the years. You need to have a loss of consciousness for you to have a concussion. Talked about that, right? So only 10% of people actually lose consciousness when they're having a concussion, even briefly. So we know that that's not something that means you have a concussion. You can have a concussion without losing consciousness. You need to have a direct blow to the head for a concussion to occur. We've already talked about it. Hitting the head, neck, or body can affect the brain because it's in that water cup there that can get damaged by just hitting the skull. 3, concussions are only a sports injury. Slips, falls, and motor vehicle accidents are all possible causes. So we don't need to just have a sports injury. So we don't have to be an athlete to get a concussion. You should stay awake after a concussion, 4 to 6 hours. That's what we're looking for, right, guys? So we want them to rest and sleep because that's essential for brain recovery. And the first 4 to 6 hours is what we want to monitor those red flags we talked about: worsening of a headache, lack of consciousness, neurological deterioration. Those things are really important to take into account. Helmets prevent concussions. Not great, right? Because we know that the brain kind of moves around. Once we get hit, it moves around, even if you're wearing a helmet or not. As we know, it's not just a head hit that matters about a concussion. They're great for skull fractures, but the brain still moves, right? And I know there are even better helmets out there with like foam on the outside part, but they're not really that fashionable. And also, you can't put advertisement on them or your logo. So they're kind of frowned upon, unfortunately, even though they're more practical and are probably better for the head and absorbing those forces. 6, concussions always show up on CT scans. We talked about the imaging. They don't always show up. We need PET scans fMRIs to actually see things. And sometimes I guess those big organizations like the professional sports world, they can get those immediately. We can't on a lot of basis. So we're not seeing those things. So just because the scans show up negative, it really is there to rule out bleeds and other detrimental structural problems rather than just saying if you have a concussion or not. Kids bounce back quickly from concussions. Not really, right? Their kids are still growing their brains, they're developing, they're learning new things. So they're actually more vulnerable because of all the different mechanisms that are going on. They're not stable at this point. They're still learning. And even having a concussion at a critical period of time, like, when they're learning algebra or whatever, can often slow them down from knowing and remembering those type of concepts. So they actually get behind in learning. So we want to make sure that we're getting the proper recovery. So their learning goes on without a skip, and they can keep going well and progressing well throughout high school and university and things. You can tough out a concussion. We're not looking at toughing out concussions, right? We want to make sure that concussions are dealt with properly. They get the proper recovery time, proper sleep, all that stuff. If you ignore a concussion, you keep pushing through things. This is where we see a lot more PCS, which stands for post-concussion syndrome, or PPS, persistent post-concussion symptoms. So we make sure that we take it at immediately. The recovery is the most at the very beginning of this stuff. So if you push through at the beginning, you have more likelihood of having persistent symptoms than if you take the proper time to rest and recover, which is seen in many studies that have been proven over the years. Once symptoms are gone, you're fully recovered. We know symptoms are one of the first things that leave, and you need to make sure that you are still recovering well. That's why sometimes we do our assessments in the clinic to go, okay, you still can't run, at 80% of your maximum capacity of heart rate. We still know that your eyes are still kind of a little bit jagged when you're doing things, even though everything seems clear. We got to make sure that everyone's checked out properly, and especially those kids that are still learning and doing things. We're looking at least a month for their physiologically inside of their body. Metabolic kind of rates and recovery are up to snuff rather than just, I don't have a headache anymore. I don't have light sensitivities or noise sensitivities, some of those symptoms that are often found at the beginning. So topics we talk about to educate our client. We use this picture a lot to educate our clients here. The bell is when the symptoms come up. The fire is basically when we're trying to go through symptoms and exacerbate those symptoms. So at the beginning, we're looking at once the bell comes on, we quit, we take breaks. Okay. The other way, once we've been in it for a while, we might have persistent concussion symptoms. We want to learn from that to create better pathways. And that's where we kind of go up by that 2-point rule here. So at a scale of 1 to 10, if it's at a 4 and it goes up to a 6, we stop, we take a break, we relax, symptoms go back down to 4, and then we can continue again. And that's what we talk about up here, taking breaks when symptoms flare up. We recommend working with short blocks and scheduling breaks, which is one of the patients that I have. She had a hard time learning that, just because people feel like they depend on you, the family depends on you, you got to take your breaks, or you're going to have the next day where you're going to either crash or headaches are going to be a lot worse and you can't do as much. So let's take those things into account and make sure that we're recovering properly. Secondly, we want to limit screen time for the first 48 hours so that we're not stimulating the energy to be used at looking at screens. We're using that for recovery of the brain. Sleep-wise, sleep is where we recover. We get rid of all the inflammation in the brain and all those extra proteins that are floating around there that we need to dispose of so that we don't have that fogginess and other headaches that accompany that. Nutrition, we want nutrition of our overall decrease inflammation, right? So anti-inflammatory things, those fruits, those vegetables that have anti-inflammatory properties. We do want to have healthy fats, avocados, some nuts, not overeating on those things either, but that helps to repair some of the neurons in there because they're made of fatty tissue. Symptom management strategies, we use palming, grounding, breathing, even facing cool water helps decrease the temperature, helps decrease inflammation. The breathing's really great. Meditation, you can find those all online. Look up YouTube on Yoga Nidra, non-sleep deep rest by Dr. Andrew Huberman are all great strategies to do things. And hopefully you have to practice those over and over again, because when you're practicing them over and over again, they become entwined in when you do need them the most. So if you're stressed and irritable, a lot of times breathing and meditation don't work because you can't do that in the stressed environments. You have to practice that when you're not stressed so that you know how to do it automatically and it becomes a reflex. Lastly, the concussion process in the brain and the recovery plan. Having a plan of when to go back to work, back to activity, and knowing that there is a plan going forward and we're not just guessing is usually a great thing. That's why we see practitioners early on to give that confidence that things will get better. Secondly, to show you where you need to do things and how to make sure that we don't exacerbate symptoms and recovery is a plan so that you can get back to what you love to do, see that family, get to your activities, go back to work and school. Here's just the roadmap. Field side testing after you kind of get injured, or from that, you might go to the hospital. There's red flags. Remember, our rest is 0 to 48 hours. Parasympathetic nervous system activation tips. We talked about that because we haven't talked about it yet, is just that breathing meditation because it calms down the body. And when we're calm, we do things and we function better and we decrease symptoms. Then at 3 to 4 days, we're looking at sub-threshold symptoms or aerobic exercise. So no symptoms with that. Once we get that, we rest. And then at 4 to 7 days, if we haven't gone to a clinic or getting an assessment done even online, remote assessment, they call it, we need to get that done. Okay. Sub-symptom exercise is continued inactivity so that we are getting that blood flow and our bodies are meant to move. That's why it's really good. We know that exercise is one of the number one things that help with concussions as well, as long as we're not overdoing it. So in summary here, we have rest, education, subthreshold exercise we just talked about, and assessments and screens that we want to get done. So in a lump sum, that's what we need to do starting from, day 0 to about day 10. Thanks, everybody. Thanks for listening. If you have any questions about concussion or acute concussions or know of a organization that would love us to come and talk, we'd love to do that. We're going to do one for an equestrian group, a social group there that wants us to come and present for them. So we'll be doing this as well for them. And hopefully, if you have anybody that would love to have more information, we'd love to talk to them. We see results, guys. So if you guys can come and see us, we'd be more than happy. We do necks, backs, wrists, every joint that you can think of. So we're here to help. You can reach us at proactionsportsclinic@gmail.com or 613-505-5000. Thanks again. Have a lovely day, guys. Thanks for listening.